kids taking their own lives, and that was in Bearskin Lake just before Christmas when that young girl took her own life. There is something wrong. There is something horribly wrong with the healthcare system, and we need to bring that to the attention of the public, of the provincial government, of the federal government, that they need to work with us, that we can no longer just sit idly by and accepting the status quo, that something needs to change. And that's why we're...
The voice you just heard was Grand Chief Alvin Fiddler of the Anishinaabe Aski Nation. And one of the issues he recently commented on was the death of Ruth Ann Quaquish. Ruth Ann lived in Kingfisher Lake, First Nation, a community in northwestern Ontario, and at 31 years of age, died of diabetes-related complications after having visited the community's nursing station multiple times in the days leading up to her death. A discretionary inquest involving a jury hearing the circumstances surrounding Ruth Ann's death was held. The inquest provided several constructive recommendations for concrete actions and reforms that various healthcare groups named in the jury's findings could implement. Chief Fiddler, though, stated that ultimately it was neglect, racism, and chronic underfunding that killed Ruth Ann. He noted that there's a critical lack of healthcare services across NAN territory that continues to claim the lives of their members. In short, discrimination exists within the Ontario healthcare system, and it's something that requires attention. This scoping review of the Ontario context aims to determine the context of discrimination claims. Are they denial of entitlements, denial of service, removal of service, or reprisals? Summarize what kinds of discrimination claims are being made. Are they direct or systemic? And this includes a service gap for people living in rural and remote areas. That has received some attention in the literature. Identify which groups are most represented in discrimination claims and studies. Indigenous people, as mentioned, but also people with mental health disabilities, race, gender expression. But most importantly, the goal is to describe what is currently being done or what recommendations are being made to address the issue. Because as Chief Alvin Fiddler mentioned, the situation is intolerable and can no longer continue. And finally, we can identify the existing gaps that current studies do not address concerning being able to provide further remedies or create systems to better prevent discrimination from arising in the first place. So to that end, this review analyzes cases from the Human Rights Tribunal of Ontario, peer-reviewed studies of discrimination in healthcare, and reports from prominent health organizations, including the Canadian Medical Association, the Ontario Medical Association, and the Ontario Human Rights Commission, who are invested and engaged on these issues and in these spaces. For those invested in building a more functional, inclusive public health care system in Ontario, this scoping review provides stakeholders with concrete data to advance, support, and implement meaningful and measurable healthcare reforms and remedies for the discrimination that many groups and individuals experience.